Hello class, I am Dr. Kaban. Today's presentation is on Chapter 18, Safely Lifting, Moving, and Positioning Patients. This begins in your textbook on page 267. Due to the length of this chapter, I will present this material to you in two video parts. Today's presentation is on Chapter 18, Lesson 18.1, an overview of anatomy and body mechanics, movement, and alignment. Let's get started. Lesson 18.1. Upon reviewing this presentation as well as reading your Chapter 18 in its entirety, you'll gain the following knowledge. You'll be able to describe the anatomy and function of the musculoskeletal system, explain the importance of proper body mechanics, alignment, and position change for both patient and nurse. You'll be able to discuss the principles of safe body mechanics and positioning, giving an example of each principle, as well as being able to identify ways to maintain the patient's correct body alignment in bed or in a chair. Let's begin with an overview of the structure and function of the musculoskeletal system. The musculoskeletal system contains the skeletal muscles, ligaments, tendons, bone, joints, and cartilage. Please review how the bones and muscles work together. Bone is a dense, hard type of connective tissue. There are four types of bones: short, long, flat, and irregular. They are made up of compact and spongy bones. Joint is defined as a union of two or more bones which moves freely. Bursa is a small fluid-filled sac that provides a cushion at friction points in the bone joints. Skeletal muscle are striated muscles surrounded by a connective tissue sheath. Tendon is defined as a fibrous tissue that connects muscles to bone. Ligaments are defined as those that connect bones to cartilage, whereas cartilage is fibrous connective tissue which acts as a cushion. Groups of muscles work together to produce a single movement. Now let's review some functions of bones. The bone provides a scaffolding to support the body. It gives shape to the body and structure and supports the internal organ and skin. And also bone places for ligaments and tendons to attach to facilitate movement. Joints again allow movement and flexibility of the skeleton. Please review the anatomy and function of cartilage, ligaments, and tendons. What are some functions of muscles? Well, muscles can stretch. Muscles can be stimulated to contract. They provide movement, stabilize joints, produce heat, and also maintain posture. Good posture is important to prevent fatigue and joint deformities, provide strength, and support the position of internal organs. What are some changes that occur with aging? Well, during aging, bone mass loss may lead to osteoporosis, which is more severe in women. There could be loss of bone density, predisposing the elderly to fractures. Muscle cells are lost and replaced by fat cells. Elasticity of muscle fibers is decreased, which therefore will limit flexibility. Joint muscles may decrease, limiting motion and mobility. So ask yourself this question: how do male and female skeletons differ? Well, the male hip bones form narrow, deep funnels, whereas the female hip bones form broad, shallow basins. Bone growth and strength depend on minerals, vitamin D, and blood supply to the bone. Bone disorders are common in elderly people. Let's review some basic principles of body movement for nurses. Unfortunately, one of the most common injuries in healthcare workers is lower back strain. So to prevent this, whenever possible, ask for help. Encourage your patient to assist when transferring and moving if at all possible. Use thigh, arm, or leg muscles rather than your back muscle, and use a wide base of support. Provide stability for movement. So how do you do this? You do this by keeping your feet apart, about shoulder width proximity. Use the greatest number of muscles possible. Use smooth, coordinated movement. Keep loads close to the body. Keep loads near to the center of gravity. And also pull and pivot using smooth, coordinated movements. Avoid any jerky or sudden pulling movements. Remember, when you're moving objects, use leg muscles to prevent back strain. See figure 18.3 in your textbook on page 270. When you're moving and lifting your patients, remember to keep your elbows close to your body and work close to your body as well. Work at the same level or height as the object to be moved. Keep the load near your center of gravity. Also, pulling actions require less effort than pushing or lifting. And remember to face the direction of the movement. Use arms as levers when pulling patients towards you. Lock your elbows and rock back on your heels using weight of your body to move the patient. Here are a few basic principles of body movement for patients. So the two basic principles are that you maintain correct anatomic position and change position frequently. Hazards of improper alignment and positioning are those that interfere with circulation, which may lead to pressure ulcers, and also muscle cramps and possible contractures. Additional hazard of improper alignment and positioning would be the collection of fluids in the individual's lungs. What are contractures? Well, contractures are resistance to stretch in damaged muscles that pulls a joint into a fixed or frozen position. How can you prevent contractures? Correct body positioning will help prevent contractures. Please refer to your textbook on page 269 to look at this figure 18-2. This is an example of correct standing body alignment. Eighteen 5 is an example of correct sitting body alignment. Let's define pressure ulcers now. So pressure ulcers are also known as decubitus ulcers or bed sores. They occur when pressure on the skin causes an area of local tissue necrosis. It occurs most often between a bony prominence and an external surface. Pressure ulcers may also be caused by shearing as force is applied downward and forward on the tissue beneath the skin, as when a patient slides down in a chair. Now let's review the application of the nursing process. Remember that the nursing process begins with assessment or your data collection. What questions would be asked during the assessment of the standing patient's body alignment? So you can ask the patient or ask yourself, is the head centered and erect? Are the patient's shoulders and hips parallel? Are the knees and ankles slightly flexed and parallel to the hips and shoulders? When assessing the patient's standing body alignment, start by noting the head position in relation to the rest of the body. When assessing the patient in a sitting position, observe for symmetry. When assessing your patient who is lying down, assess carefully for alignment and correct position. When you're assessing your patient who's ambulating, Assess the patient's ability to ambulate and change position independently. Observe your patient while they are walking. Application of the nursing process, nursing diagnosis. Commonly used nursing diagnoses are as follows: risk for injury, impaired physical mobility, risk for impaired skin integrity, and impaired walking. Application of the nursing process, planning stage. So now you've assessed your patient, you formulated your diagnosis. Now you have to decide how to change the patient's position and whether you can delegate this task to an assisted personnel, such as your nurse's aide. In the home setting must be considered when planning care for the patient. What are your expected outcomes of planning? Your expected outcomes are as follows. Patient will experience no musculoskeletal injuries. Former level of mobility will be retained within 6 months. Skin integrity will remain intact while the patient is on bed rest. Patient will not experience injury while ambulating. And the patient should have full range of motion exercises actively or passively performed several times a day. We are reaching the conclusion of part 1. Let's review some questions together. When moving a patient, it is important to use proper body mechanics. Which of the following is not a proper body mechanic? Is it A, using your leg muscles? B, keeping your feet together to provide stability for movement? Is it C, using smooth, coordinated movements instead of jerky or sudden movements? Or is it D, keeping lows as well as your elbows close to your body? When following proper body mechanics, the one that is not correct is B. Keeping your feet together to provide stability for movement is incorrect. When moving a patient, you should keep your feet about shoulder width apart. This provides you with a wide base of support, which is great for providing stability for movement. Question 2. Leanne is teaching her patient's husband how to lift his wife safely. Which of the following is true regarding lifting the elderly? Is it A, as the body ages, there is no change in posture? Is it B, there is usually an increase in muscle mass as we age? Is it C, whatever items that could be lifted in your youth should be lifted in later years? Or is it D, joint motion may decrease, limiting mobility? Well, the correct response here is D. Joint muscles may decrease, limiting mobility in the elderly. It is now time for a break. This concludes my presentation to you on part 1 of chapter 18.